Okay, so let's start the third and final segment on the abdominal viscera and their blood supply. In addition to blood supply, I will, briefly talk about the nerve supply of the abdominal viscera as well in this segment. So as you can see, the abdominal aorta is entering the abdomen from the thorax through an opening in the diaphragm, which is called the aortic hiatus, that is located at the level of T12 vertebra. And as it travels through the abdomen and going down in the abdomen, eventually it divides into two final terminal branches, which are the common iliac arteries. Okay, and if you look at the branches, especially which are coming from the ventral aspect or anterior aspect of the aorta, there are three branches, and they will be our main focus of today's talk. And they are the ones responsible for the blood supply of the abdominal viscera. Now, three of those, number one, the first one is called the celiac trunk, that arises from the ventral aspect of the abdominal aorta as soon as it enters the abdomen. Now, right below that, at the level of L1, so you see this one is at the level of T12 to L1, and at the level of L1, another big branch coming from the ventral aspect of the aorta, which is the superior mesenteric artery. And at a distance here, at the level of L3 vertebral level, there is another branch which is relatively smaller than the other two, is the inferior mesenteric artery. So the celiac trunk, superior mesenteric artery, and inferior mesenteric artery, which are arising from the ventral aspect of the aorta, these three branches of the abdominal aorta are responsible for the blood supply of the luminal GI tract mainly, and also the other abdominal viscera as well. So now we want to, as we describe the blood supply of the abdominal viscera, we relate it to their embryonic origin of those structures. So now, if you think of the embryonic gut system, it is divided into three segments: the foregut, the midgut, and hindgut. So there are certain structures of the abdominal viscera which arise from the foregut, some of them from the midgut, some of them the hindgut. And there are specific arteries to distribute blood to the structures coming from the foregut, midgut, and hindgut. So as we say, the celiac trunk is the artery of the foregut. So the foregut structure, these are the ones: abdominal, esophagus, stomach, the part of the duodenum, the liver, pancreas, gallbladder, spleen. These are the structures they derive from the foregut, and that's why their blood supply comes from celiac trunk. Now, superior mesenteric artery is the artery of midgut, and it provide blood supply to the midgut derivatives, which is the part of the duodenum, and jejunum, ileum, the cecum, appendix, ascending colon, and the part of the transverse colon, most of the transverse colon actually. So superior mesenteric artery, as you can see here, is supplying the parts of the GI tract that develop from the midgut. Okay, then inferior mesenteric artery supply blood to the parts of the GI tract that develop from the hindgut, and the hindgut derivatives include the part of transverse colon and the descending colon, sigmoid colon, rectum, and upper part of the anal canal. Now, if you look at this one, this is the abdominal aorta, and these are branches coming from the ventral aspect of it. Now, the first one is the celiac trunk, then superior mesenteric artery and inferior mesenteric artery. And as I said, celiac trunk will provide blood supply to the foregut derivatives. Superior mesenteric artery will provide blood supply to the midgut derivatives, and inferior mesenteric artery will provide blood supply to the hindgut derivatives. Now, where is the division of foregut, midgut, and hindgut? So the foregut began at the beginning of abdominal esophagus. As I mentioned before, abdominal esophagus is only a small part, the terminal part of the esophagus. That from there all the way to the duodenum. The second part of the duodenum, we mentioned about the major duodenal papilla, which mark the opening of the hepatopancreatic ampulla, which is a joint duct formed by the bile duct and the pancreatic duct. Their opening is marked in the second part of the duodenum, or in the descending part of the duodenum, by major duodenal papilla. Okay, so major duodenal papilla is the junction between the foregut and midgut. So this is the end of foregut, that begin at the abdominal esophagus. Okay, and this is the end of foregut. So from here below the major duodenal papilla is the beginning of midgut, and midgut continues all the way to the transverse colon, where you see in some text you will see it will say the end of transverse colon is the part of the midgut or the territory of the superior mesenteric artery. In this particular text, so your text is Gray's Anatomy, they say the proximal two-third, the proximal two-third of the transverse colon is the territory covered by superior mesenteric artery, and distal one-third, beginning at the distal one-third, is the territory covered by the inferior mesenteric artery, and that also marks the junction between the midgut and hindgut. So again, hindgut include most of the descending colon, the sigmoid colon, the rectum, and the upper part of the anal canal. Okay, so these are the divisions of primitive gut tube, and we have three arteries for three the derivatives of three part of the primitive gut tube: foregut, midgut, and hindgut. Okay, now let's go to the specific of those artery branches. So let's start with the celiac trunk, that is the first one. And the celiac trunk has three branches. One, you see, going behind the stomach, and running over the pancreas. It is the splenic artery that goes all the way to the spleen. You can see the background here on the posterior aspect of the stomach. You can see the spleen here. So the splenic artery that provides blood supply to the spleen mainly, and also it also provides some blood supply to the pancreas. And then the other two branches are left gastric branch, which goes up towards the esophagus and provides some esophageal branches that provide blood supply to the abdominal esophagus. And then the left gastric artery comes down along the lesser curvature of the stomach. Okay, here around the middle of the lesser curvature, it anastomoses with the right gastric artery, which is a branch of the common hepatic artery. See, this is the common hepatic artery. This gives a branch which is the right gastric artery. In the lesser curvature of the stomach, the left gastric artery, which is a branch of common hepatic artery, anastomoses with the left gastric artery, which is another branch of the celiac trunk. Okay, so now we are done with the splenic artery and the left gastric. Now, one important thing I want to mention about splenic artery, you see here in the drawing, you can see the tortuous nature of the splenic artery. That will be a very important identifying point of the splenic artery. Not only it will run at the upper part of this the pancreas, that I will show you when I talk about the pancreas. Also, it lies posterior to the stomach, and also it has a tortuous course actually. So its tortuous appearance will make sure that this is the splenic artery. Now, the another branch is the common hepatic artery that give rise to right hepatic artery, right gastric artery. We talk about it, and then it gives a branch here called the gastroduodenal artery that goes down towards the duodenum. And the rest of the hepatic artery, now at this point we call it hepatic artery proper. It goes towards the liver, hepatic artery, which means it should go to the liver, and then it divides into two branches, right and left hepatic artery. When we talk about the liver blood supply, we'll go into detail of that. And then the gastroduodenal artery, it gives one branch called supraduodenal artery, and then in addition to that, it gives two important branches. One goes behind the duodenum called the posterior superior pancreaticoduodenal artery, and then the one goes anterior, which is called the anterior superior pancreaticoduodenal arteries. These arteries provide blood supply to the part of duodenum and the part of pancreas. That's how they got the name of pancreaticoduodenal artery. Okay, so these are superior mesenteric celiac trunk branches mainly, and this superior, posterior superior, and anterior superior pancreaticoduodenal artery, which are branch of celiac trunk, they anastomose with a branch of superior mesenteric artery, which is the inferior pancreaticoduodenal artery. So superior pancreaticoduodenal artery is a branch of gastroduodenal artery, and inferior pancreaticoduodenal artery, I will show as a branch of superior mesenteric artery, is a branch of superior mesenteric artery, and those superior pancreaticoduodenal and inferior pancreaticoduodenal artery, they anastomose with each other on both anterior and posterior aspect of the duodenum. Okay, so these are the branches of celiac trunk. Now let's look at the branches of superior mesenteric artery. As you can see, superior mesenteric artery is arising from the anterior aspect of the abdominal aorta right underneath the celiac trunk. So this is the celiac trunk, this is hepatic, this is the splenic, this is left gastric. Now superior mesenteric artery is coming from the ventral aspect of the aorta. And now I mentioned about this relation when I was talking about the duodenum. You see, this is the third part of the duodenum. Okay, and then you can see third part of the duodenum is running in the angle between the superior mesenteric artery and the aorta. Here you can see the aorta here and the superior mesenteric artery here. You see, and the third part of the duodenum is running in the angle between those two big blood vessels. In addition to that, left renal vein is also, as you can see, the left renal vein that is coming from the kidney, that also run in the angle. So any growth or the aneurysm in either the superior mesenteric artery or abdominal aorta in this area will compress the third part of the duodenum. Okay, now so that is an important relation. Now let's talk about the branches. So one branch, so this, as I said, the superior mesenteric artery will supply blood to the midgut derivatives that include the part of duodenum below the major-duodenal papilla and the rest of the small intestine and the cecum, ascending colon, and proximal 2/3 of the transverse colon. Okay, and this blood supply is provided by one of the ileal branch, and there is a right colic branch, there is a middle colic branch that goes to the transverse colon, and so these are the branches, right? So, and also the ileal arteries or the ileocolic arteries give a branch that provide blood supply to the appendix called the appendicular artery. Okay, so all this territory is covered by superior mesenteric artery. So beginning at the duodenum below the major duodenal papilla all the way to the almost the end of transverse colon. And these are the small intestinal branches. They are called the intestinal arteries. They are called jejunal and ileal arteries, and you see they form the anastomotic loops called the arterial arcades, and the straight arteries or vasa recta arise from the arterial arcades. So that's how it supply blood to the area of superior mesenteric artery. Now the inferior mesenteric artery. Look at the inferior mesenteric artery arise from the anterior aspect again of the abdominal aorta before it divides into two terminal branches, which are the common iliac arteries. Look at here, this is the inferior mesenteric artery. So inferior mesenteric artery provides an ascending branch that covers the terminal portion of the transverse colon and the whole descending colon, the sigmoid colon, rectum, and anal canal. And the branches include the ascending branch that covers the transverse colon and the descending colon. And then there are some sigmoidal branches that provide blood supply to the sigmoid colon. And then another important branch is the superior rectal artery that provide blood supply to the upper part of the rectum. Okay. Now you look at another thing that you can see here is the marginal arteries. Let me show you the marginal arteries. And here you see on this one, you can see all three arteries and their territories covered and their branches. This one is the celiac trunk, this is the superior mesenteric artery. Again, the third part of the duodenum is at the angle between the superior mesenteric artery and the aorta and inferior mesenteric artery. And the autonomic nerve fibers in this area, they go along with the arteries, and the most lymphatic vessels and node lie along the arteries as well. Okay. So one thing I wanted to make sure here is the marginal arteries. So you see this is the marginal artery, and marginal artery is formed by the anastomosis between the branches of superior mesenteric artery and the inferior mesenteric artery. They form a complete loop around the the large intestine. Here they form the marginal artery. I will talk about the marginal artery later as well in a different slide. So three important aspects of the blood supply of the GI tract that I want to mention here. As I mentioned when I was talking about the duodenum, the duodenal ulcer is a common clinical situation, and the most commonly involved areas in the duodenal ulcer is the this the first part of the duodenum. Okay, so now if there is an ulceration in the proximal part of the first part of the duodenum, and if the ulcer erodes on the posterior wall of the duodenum, it can eventually reach the posterior superior pancreaticoduodenal artery or the gastroduodenal artery itself. Okay, so either it will involve the gastroduodenal artery, or more commonly the ulcer will erode into the posterior superior pancreaticoduodenal artery. Okay, so now if you have an ulcer in the posterior wall of the duodenum and that erode into the blood vessel, that can cause profuse bleeding from either gastroduodenal artery or from the more commonly the posterior superior pancreaticoduodenal artery, which lies posterior to the duodenum, of the upper part of the duodenum. Now, second significant thing that I want to mention here is that I mentioned about marginal artery. You see, this is the marginal artery here. Now, the marginal artery is formed by the branches, the anastomosis between the branches. These are the branches of this is the ileocholic artery, this is the right cholic artery, and this is the middle cholic artery. You see, they are branches, including the branches of ascending branch of the inframesenteric artery, the sigmoid arteries. So they are branches anastomosed with each other to form a marginal artery. Now, what is the importance of marginal artery? For any reason, for an example, an aneurysm in the aorta or at the beginning of inframesenteric artery may occlude the inframesenteric artery. So if the inframesenteric artery is occluded, though this part, the region which is normally covered by inframesenteric artery, will not get blood supply coming from the inframesenteric artery. But in that situation, the marginal artery, which is formed by the branches of the supramesenteric and inframesenteric artery, will now provide blood supply to the area which is normally supplied by the inframesenteric artery. So that is the importance of marginal artery. Now, another important area is the blood supply of the rectum. As you can see, the rectum here, the rectum is getting its blood supply from three different sources. One is the superior rectal artery, that we talk about the superior rectal artery, which is a branch coming from the inferior mesenteric artery. Then we have a middle rectal artery. You can see the middle rectal artery. These are the two terminal branches of the aorta, which are the common iliac. Common iliac divided into internal iliac and external iliac. One of the branches of internal iliac artery is the middle rectal artery, which is here. And then one of the branch of internal iliac artery is the internal pudendal artery that provide another branch to the lower part of the rectum, which is called the inferior rectal artery. So again, if we summarize it, the rectum is getting its blood supply from three main branches. One is the superior rectal artery, which come from the inframesenteric artery, then middle rectal artery, which is a branch of internal iliac artery, and inferior rectal artery, which is a branch of internal pudendal artery. And again, internal pudendal artery is actually a branch of internal iliac artery. Okay. Now, about the innervation of the GI tract. You know, GI tract, these are viscera, right? So if they are viscera, so the title of our lecture is the abdominal viscera. So when we talk about the viscera, they cannot be innervated by the somatic nervous system. Until now, you saw the brachial plexus branches. So if you think of the targets of the brachial plexus, they all goes to the skeletal muscle and to the skin. Okay, so that is the somatic part of the nervous system. This is a completely separate part of the nervous system, which is the visceral nervous system. Visceral nervous system is divided again into a sensory and a motor. Okay, so the motor part of the visceral nervous system is called the autonomic nervous system. Again, autonomic nervous system is divided into two components. One is sympathetic nervous system and parasympathetic nervous system. We will have a lecture about autonomics, so I would like you to wait until we have that lecture so that things will be clearer. At this point, I don't want to get into too detail of it. But remember, as a whole, the sympathetic will be involved in more like fight and flight. We say during the fight and flight, you need sympathetic innervation, and during the rest and digest, you need the parasympathetic nervous system. So the sympathetic nerve will come from the T5 to, you see through this, the T5 segment to L3 segments. So these are the nerve fibers coming from the sympathetic, the lateral horn of the spinal cord, sympathetic nerves. You may have seen the greater thoracic splanchnic, lesser thoracic splanchnic, and least splanchnic. At least you must have seen the greater thoracic splanchnic nerve in the lab. So these nerves, they enter the abdomen, and then they distribute the viscera. Okay. Now the last part of the abdominal viscera, they get their sympathetic innervation from the lumbar splanchnic nerves. These are the thoracic splanchnic nerves that provide innervation to this GI tract parts, the liver, stomach, small intestine, and the part of the large intestine. Now the distal part of the large intestine and the rectum, they get their sympathetic innervation from the lumbar splanchnic nerves. Again, when we say splanchnic, we mean viscerous. Splanchnic is viscerous, so splanchnic nerves means that provide innervation to the viscera. Okay. Now these are the sympathetic innervation. Parasympathetic innervation will come from vagus nerve. So 4 cranial nerve will have parasympathetic fibers. They are 3, 7, 9, and 10. We don't have to worry about 3, 7, 9 because we will deal with them when we talk about the head and neck area. But all these, the visceras will get their parasympathetic innervation from the vagus nerve. So vagus nerve will cover the parasympathetic innervation beginning from the abdominal esophagus all the way to the end of the midgut, and hindgut will get its parasympathetic innervation from the S2-3-4 segment. Okay, they will form the pelvic splanchnic nerve, pelvic plexus, and they will cover the terminal part of the transverse colon, this descending colon, sigmoid colon, and anal canal. Okay, so parasympathetic is coming either from the vagus, the upper part, and the lower part will be coming from S2-3-4 segments, that is parasympathetic, and sympathetic will come from T5 to L1, L2 segments, and they will come through the greater thoracic, lesser thoracic, least thoracic splanchnic nerves, and also the lumbar splanchnic nerves. So detail of it we'll talk after we cover the autonomic nervous system. Okay, I think that's all I have for you for the first lecture of the abdominal viscerals and their blood supply, and we talked in brief about the nerve supply as well. As we talk about the individual segment, when you see the individual segment in the lab, I think things will be clear up a little bit more. And if you have any question about all the segments of this lecture, don't hesitate to let me know. As I mentioned before, you can send me email, you can call me, you can text me, whichever is convenient for you. Thank you for your attention.